Good afternoon and welcome to our show today, Northport, A View from Here. I'm Gene Matthews, your host. With us today is Jack Donahue, who is the Administrative Director of the new Bon Secours Health Park located in Northport. And we're really excited that Bon Secours is there. And Jack, I'd like to just ask you a question, if I may. What is your background with the medical administration in the area, outside the area?
Well, my background in the medical profession starts with a clinical background. I'm a registered nuclear medicine technologist and radiology technologist, and the first 10 years of my career was spent in the clinical application of those fields. And then, to be honest with you, Gene, somewhere along the line, somebody convinced me to get into the supervision aspect of it, and for the last 12 years, I have been in either a supervisory or administrative role in providing healthcare ancillary services, outpatient diagnostic testing, and so forth. So my administrative experience spans back 12 years with the development of services in an outpatient environment.
Good. Bon Secours, of course, has come into Northport in a big way. And what is the corporate philosophy of Bon Secours? Because they're heavily invested into this area.
And that's a great question, because in my career, I actually reached a turning point of philosophy. And what I got into healthcare in the very beginning tended to evolve as the years went by to be less than what my original mark was. And my opportunities with Bon Secours gave me that ability to go back to my original goals in healthcare, and that was to be consistent with the philosophy of helping people. Bon Secours is a corporation that's really unique in healthcare, in my opinion, in that their core values are extremely consistent with their driving desire to provide good healthcare to people in need. So the philosophy of Bon Secours is very consistent with my need and what I would like to think all healthcare workers' needs are to provide good healthcare in an industry that in today's market increasingly becomes a business as opposed to a provision of healthcare services.
Yeah, and you know, in our community, as in other communities, healthcare becomes more and more important as Northport grows. The families coming in, and of course our retired generation, they have a great deal of needs in that area. Bon Secours has a health park in Venice and a hospital in Charlotte. Is there an interrelationship here, or are we standalone? You know, give us a rundown on how that all works, if you will.
Well, we actually have the advantage of having the best of both worlds in that regard. Northport Health Park is very definitively services that have been put in place to serve the needs of the Northport residents. We are owned and operated by Bon Secours, and so as such the Northport Health Park is owned by a national corporation. We have an inextricable link to St. Joseph's Hospital in Port Charlotte, as this is an entity that falls under their corporate structure. So we have a link down in St. Joseph's with the fact that the organization is administered by the St. Joe's Healthcare Group down in Port Charlotte. But bear no mistake about it, the design and future planning and goals of the Northport Health Park are to serve Northport residents. So I like to think we have the best of both worlds in that regard. We have the strength of a national organization that has a wonderful resource of information and administrative skills at a corporate level, but by the same token we operate independently from the standpoint of developing services that meet the needs of Northport.
So you deal locally and supply and take care of local needs rather than one paintbrush covers the whole gamut of it. That's good. I think that's very important for us. What made Bon Secours come to Northport? I mean, it's a big move. You all invested a lot of money here.
It is a good question. Northport is within, of course, the primary and secondary markets of both Venice, Bon Secours Venice Hospital and Bon Secours St. Joseph's Hospital. And in doing extensive market surveys in the preliminary stages of the development of the Northport Health Park, they were able to determine that there was a very large percentage, proportionate percentage of the residents of Northport who were by necessity outward migrating for healthcare services into both markets, both Port Charlotte and Venice. And those market surveys revealed that in each market there was a contribution of between 10 and 15% of the patients served that were actually coming from Northport. Consistent with the philosophy and goals of Bon Secours to be able to bring health care to their service areas in a convenient fashion, they saw the merit of being able to bring those services physically to the Northport market, and their market analysis revealed that the population that Bon Secours was already serving in the other markets supported that investment.
Okay, very good. One of the chief complaints of Northport residents over the years has been the citizens have been paying taxes to Sarasota Memorial Hospital and receiving no perceived benefit from this. How do you all work with Sarasota Memorial at this point?
Well, it's another great question, Gene. In fact, we have just finished formally signing an agreement with the Sarasota Memorial Hospital to assume operational responsibility for the Northport after-hours clinic that previously was operationalized by Sarasota Memorial. And we will be moving that clinic into the Northport Health Park, and activities will commence on May 15th. Sarasota Memorial will continue to provide operational funding for that clinic. So consistent with their obligation to provide some return of tax investment, they will be providing Bon Secours with operational funding to assist in that endeavor.
Okay. We need to take a break now. We'll see you again in about 2-3 minutes. Thank you.
There's a rumor that small-town America has all but disappeared.
Life is great, Northport.
Northport is the last Mohican. This is the place. This is going to be the last undeveloped region. The city government itself is so pro-growth, and it's just like everything is in the right place at the right time for Northport. They're very open-minded, they're very honest, and they're very fair.
Disappeared? You've just seen evidence to the contrary. We call it Northport.
Welcome back to the second segment of Northport, A View from Here. We still have Mr. Jack Donahue, who is the Administrative Director of Bon Secours Health Park, as our guest today. And on the break, just before the break, we were talking about Sarasota Memorial Hospital, tax dollars that are raised and sent to Sarasota Memorial Hospital from the citizens of Northport. And I think I'd like to just clarify, what does Sarasota Memorial Hospital do for us now under this new agreement?
They will provide the operational funding necessary in order to cover the overhead expenses with maintaining the after-hour service access. That would include the labor component, of course, and the medical component as far as the funding is concerned. The clinic will be operating in square footage in the Northport Health Park, and that will be a component of contribution on the Bon Secours side of the coin. So Sarasota Memorial will continue to provide the funding at the levels at which they had provided previously for those services that had previously existed. And what we would like to do is to be able to look towards the future and being able to expand those services. Currently, the after-hours clinic operates Monday through Friday from 5 to 8 p.m. and on Saturday from 9 to 3 p.m. and Sunday from 10 to 3 p.m. And those hours will remain consistent at this point in time. As we move into the future, we certainly have recognized the need for walk-in care, so to speak, in the Northport community. And what we'd like to do is to grow that element of health care to be more comprehensive in that hour of coverage.
When will those new hours, the expanded hours, start?
We're not sure at this point in time. We're coming into our summer season now, Gene, and we're going to get a handle on this after-hours clinic, and as we move forward, we also have some very aggressive plans to increase the primary care presence in the building. Currently, we have a single primary care physician in the building, and in the coming months, we hope to expand that significantly because we know definitely the need is there in the community. And as we expand the primary care presence, in conjunction with that, the potential exists for us to be able to expand the after-hours clinic process as well.
In the after-hours clinic, what can people expect? Or when should they use it? When shouldn't they use it?
The after-hours clinic is a intermediate access point for limited emergent. When I say limited emergent, if you have a very significant injury, you would not want to go to the after-hours clinic. The after-hours clinic is to provide access points for the residents of Northport for those things that occur on a weekend or after hours. A child falls off his bicycle and there's a possible fracture that's suspected.
A couple of stitches here and there?
A couple of stitches here and there. Ear infections with children that, certainly that happens on a Saturday and a parent gets pretty upset and needs to get somewhere with that child. So it would be, of course, a level below an emergent care setting, Gene, that's important to note, but it will also provide routine, minimally urgent type of issues, and certainly provide at least an access point for those injuries that may be not perceived as serious as they might be, and it would give the individual an opportunity to have a medical assessment done, and then if it was necessary to then forward to a more urgent care setting, that could be done.
We've touched on some of them, but what are the benefits to the people of Northport of Bon Secours Health Park? Now, I'm sure there's a string of them. And,
that's a great question, and in fact, I did a little blurb internally in our own newsletter within Bon Secours, and I asked all of the folks that were instrumental in bringing the place up and operational to take a step back and have a look at what we had done. And in the very first month of operation of the Northport Health Park, there were 3 interactions that I had that were very significant to me. One was a very elderly gal who stopped me in the hallway and wanted to thank me because traditionally she had been taking her husband, who was a severe stroke victim, great distances to get physical therapy services. And we have a very extensive physical therapy department at the Northport Health Park, and she no longer had to make that long, arduous traveling, and that can be very difficult for an elderly person that's trying to work with an individual that has very, very much impaired motor skills. So she was just very grateful that that could take place. Another lady made it a point to talk to me about the fact that she was now able to drive 5 minutes to get a simple mammogram. Previously, the ladies in Northport had to drive either 12 miles north or 10 miles south to get a mammogram. And a simple mammogram is just basic health care. And that lady was very grateful that she no longer had to make that long trip. Third individual who was also grateful, and it was actually a group, was the Lamaze class, which are the childbirthing classes. And in our first class that we held at Northport Health Park, the 8 gals that had enrolled were, again, very appreciative of the fact that they didn't have to travel to Port Charlotte or to Venice just to get simple Lamaze. So there's 3 examples of benefits to your community that we feel it really is something that you can say consistently across the services. Folks no longer have to travel great distances. And, Gene, for you and me, that might be pretty simple to jump in the car, drive up to Venice. But for many folks, that's an arduous journey for them. So I'd like to say there's a tremendous benefit, if only the fact that the services are very conveniently accessible.
Yeah, bringing these kind of services and other services into Northport is very important to us as residents here, because it does save us the time and minimizes our time on the road. It wasn't too many years, in the early 60s, I believe, that the last phone line was on the other side of the Myakka River. So if you wanted to call from Northport, you had to go across the river to make that call. So this is really exciting. we have doctors that have practiced in Northport for many, many years and have served the community well. How are these doctors going to, or are they interacting with Bon Secours so it's a win-win situation for them, for Bon Secours, and of course for the patients?
Well, we have proceeded with processes at Northport Health Park to really focus on the physicians that have made a commitment in that community and have a presence and a practice in that community on a full-time basis. We currently our services are available for any physician to refer patients to. And we are seeing that our primary referral base is currently with the physicians that are based in Northport. And as we move forward with soliciting information and comments and feedback about what are the needed services in the area, we target the Northport physicians as very primary sources of information. We want to, and I'll say this carefully, we want to have a bias towards those Northport physicians. They're important to the Northport community. Obviously, they're physicians that have made a commitment in the Northport community. We have made a commitment to that community, and we want to have a comparable commitment to the physicians there in Northport. We will continue to work to serve physicians from all of our market areas. Bear no mistake about that, and in fact it's very important for the folks in Northport to be able to work in those markets, because many of the specialty physicians don't reside in Northport currently, and the access to those services, pulmonology, orthopedics, neurology, just simply aren't in Northport. And our goals in the future will be to bring those specialty physicians into our building, and we would like to work towards at least having them come in on a day presence. The building is designed to be able to accommodate physicians on a day rental basis, and our goal will be to, again, consistent with meeting the needs of the citizens in Northport, solicit participation from those specialty physicians, whether they're from the Venice market or from the Northport market. And the goal is then so that an individual in Northport doesn't have to drive to Venice to see their pulmonologist or to Port Charlotte to see their cardiologist. So those goals are clear and in place, and we have a strong relationship with physicians in both markets. But we definitely want the physicians in Northport to know that we have clear intentions of being able to work with them and take their feedback with a bias in developing services to meet their needs. Dr. Massey is currently the primary care practitioner directly in the building. Dr. Eaton is an individual that we have served his patients. Dr. Islam, Dr. Gutierrez, broad participation with the physicians in the Northport market.
Good. The a health park like this does more than just the medical side of things. It does a preventative side by holding lectures, and you mentioned the Lamaze class and others. What others are you proposing or planning, or what have you done?
Well, a big initiative in healthcare in general, and Bon Secours has a very strong philosophy about preventative medicine and wellness programs as well, as a means by which we can hope to prevent people from getting sick. We have developed a very strong wellness program in our physical therapy department in the Northport Health Park. It's not a program to treat diseases or illnesses. It's a program that gives access to a broad variety of clinical skill sets in the way of the participating labor component, as well as regimented exercise facilities and so forth. The wellness program is a program where an individual who certainly is not sick can enroll in the program and access information and advice and instruction from a multidisciplinary team of individuals, which include certified diabetic educators, exercise physiologists, physical therapists, occupational therapists are all involved in the wellness program, so we continue to move towards wellness as a focus.
Sounds exciting so far. We'll be back in a moment. Thank you.
Have you seen Northport lately? Take a minute and take a look.
We really do enjoy nature, and we found it all here, right in our own backyard. Love fishing and boating on the Mayaca. You never know what you might see out there. We toured the whole state of Florida and found that Northport had everything that we wanted.
There's a lot of natural beauty, and there's a lot of wildlife here. I love the open spaces, and I love the quiet.
If you're intrigued by what you just saw, pay us a visit, and you'll see a lot more.
Welcome back to Northport, a view from here. And we're still talking with Jack Donahue, who is the Administrative Director of Bon Secours HealthPark. When we ended the break, Jack, we were talking about lecture series and things of that nature. Do you happen to know what some of those programs are that are planned?
Yes, I do. The Northport Health Park also has internally a conference room, which we have specifically developed to facilitate providing lectures to the community. The conference room is also accessible by the general public as long as the group is not-for-profit in nature and has some element of healthcare associated information. And so we have currently a number of support groups that are making use of the conference room. We have an Overeaters Anonymous support group.
Where do I sign up?
Consistent with the community room concept, we have also scheduled a number of lectures, the most recent of which was a diabetes education lecture. We had wonderful attendance. This just occurred last Friday in the opening of our diabetes education program, going back to another program that we're providing. Diabetes education is a program for those individuals who are having a difficult time managing their diabetes, and again, it brings together a multidisciplinary team that helps to work with that patient to make lifestyle changes, diet changes, and so forth, and enable them to try to control their diabetes better. So that's just an example of some of the activity that's occurring in the community room, and we will be advertising those lecture series in the local news media, as well as on our information board out on the front of the building. So as you drive by the Northport Health Park, keep your eye on that board, and it'll give you an update on what lecture series are being held.
That's good. And the wellness center, a senior wellness center, you said is a gymnasium, if
Correct.
you will, not a gym, but a workout gym, and you're monitored by skilled people, and you need a doctor's report before you can go in there, but not ongoing.
That is correct.
Okay.
They just want to make sure that the folks that sign up in the senior wellness program don't have any underlying health issues that could cause them problems in progressing in their exercise phases. Some of the values of the senior wellness program, just take for instance, if an individual who is otherwise very healthy may have had a hip fracture in the past, and they have problems exercising because of the hip fracture or the hip replacement. The individuals in the program can help to design exercise programs and certain exercises that will help to strengthen those particular old injury areas and so forth. And I think that's the value of the wellness program in that setting, is you've got a little added value that you've got some qualified staff that can guide you in the right direction in the appropriate way to exercise.
Yeah. The next question is, what hours does it run per day, and where do I sign up?
The wellness program is actually accessible Monday through Friday, 5 days a week, from 8 until 4. We are currently soliciting, as a matter of fact, I had a discussion with the Chamber of Commerce down in Northport to determine how much activity or how much interest there would be in some after-hours access to the wellness program. Apparently there's quite a few folks that would like to get into that environment, but working folks in Northport can't make that happen in that time frame. So we're going to ask the Chamber to help us with that and try to determine the need, and then if we're able to demonstrate the need, we're going to move towards expanding that to some after-hours access as well.
Yeah, the after-hour access is great for me because I qualify in all three. I'm a senior, I need it, and I work. So that would be great. How are the people in Northport, accepting, or what do they feel about, Northport Health Park?
Well, I will tell you, if you were to just measure the community reaction, Northport is a smashing success. Our open house, we had over 1,800 Northport residents attend our open house. Every single patient that has come through that door has expressed their appreciation to us for bringing those services to them so that they don't have to outward migrate for those services anymore. I'm very, very pleased with the feedback that I've gotten from the Northport community. I've attended many, I have given many talks at many of the service groups, the Kiwanis, the mobile home parks, and without exception, Gene, the folks of Northport are grateful and very positive, and are just excited as we are to be there. They're as excited as we are to be there that we are there.
That's wonderful to have that kind of excitement around. What is the current staffing there, and what do you look forward to in the future for staffing?
Well, the current staffing in the building consists of we have a registered radiological technologist, we have a registered ultrasonography technologist. Both of those individuals are also board certified in mammography as well. Myself, the administrative director, we have two clerical components, shouldn't call them clerical components, we have two gals that work in the clerical division, and we also have a physical therapist, an occupational therapist, we have a speech therapist, we have a massage therapist in the building. Of course, we have the primary care practice of Dr. Mossy. He has a registered nurse in the building. We have also, worth noting, we have consolidated our home health agencies into that building. Interestingly, one of the primary missions of the Sisters of Bon Secours originally was to provide home care in the late 19th century. They petitioned to be able to go out of the traditional cloister and go out into the homes and help the dying to be able to die in some semblance of dignity. Mm-hmm. So home care is a big, big priority with the Sisters of Bon Secours. And the home health agency, the Bon Secours Home Health Agency is very broad in their service range, and we have consolidated a number of offices into the building as well. So as far as the staffing is concerned, we've got about actually 40 to 50 home health staff members who range from nurses to nurses' aides to LPNs and so forth, and they serve the home health capacity from St. Petersburg to Naples, as a matter of fact.
And you look at this facility as expanding by how many times in the next 3-5 years? Double?
I would love to speculate, and again it would be speculative, but I'd love to speculate that the growth in the area and the need for those healthcare services would in fact expand the capacity of that building. Yeah, I would say by 2 and 5 years, Gene. I'd like to think that that's going to happen. With the expansion of your population base, mm-hmm. And seeing what I'm seeing now, it's clear to me that that community is extremely expansile. The fact that you all have garnished the ability to put a high school recently this year is just another measure of the fact that Northport continues to expand.
Is all that you're doing here through Bon Secours, which of course owns hospitals, a precursor to a hospital coming to Northport?
Well, boy, that question has come up on numerous occasions, and my answer will continue to be that that is a tremendous, tremendous initiative. It's one that the community has to be behind 100%, and it's also, subject to the gauntlet of the Certificate of Need process in the state of Florida, and that's very much hinged on population density and so forth. With the growth that I see in Northport in a 10-year time frame, I think the potential exists for there to be enough of a population base to support that initiative. But it's one that really needs to be started on a planning process now, today.
Jack, if someone wanted to get a hold of you, how do they reach you?
They can reach me at the Northport Health Park, and the phone number is 941-423-5000 is the main desk. And I'm directly available to anyone that has questions or issues with the Northport Health Park.
Well, that was Jack Donahue from the Northport Healthcare Unit, and we want to thank him very much for giving us this informative talk, and we'll see you next time on Northport, A View from Here.